Hello, my name's Rhiannon. This is HNN313's Assessment 1 Submission 2 video presentation. Patient safety and best outcomes is the priority as outlined in the Australian Commission on Safety and Quality in Healthcare Standards 2012. The role of the perioperative nurses in the surgical count is fundamental in achieving patient safety and best outcomes. Today I will explain the role in detail. As stipulated in the Australian College of Operating Room Nurses Manual 2014 ACORN, it is the nurse's responsibility to ensure that they are competent to perform the role of a perioperative nurse. A systemic, planned and documented approach must be applied to activities undertaken by any perioperative nurse in order to ensure that an optimal patient outcome and accountability are seen to. ACORN. The surgical count is a process that is performed to minimise the risk and ensure that all gauze, sponges, swabs, needles, devices and instruments are removed from the patient during a surgery, except when they are to be intentionally retained. ACORN. It is important that there is minimal noise and interruptions during the count to minimise errors. Aseptic techniques such as keeping hands at waist height and avoiding edges of the designated count table should be maintained at all times where possible. It is important to check for the sterile indicator before counting the instruments. This will indicate that the instruments have undergone a satisfactory sterilisation process and are ready for use. The best practice is to have a routine count order, and it usually goes sponges, sharps, miscellaneous items, instruments and devices. Sponges have a radio-opaque strip embedded in case there is a discrepancy found. The radio-opaque strip will show up in an X-ray. The surgical count is always checked by two people, mainly the perioperative instrument nurse and the circulating nurse, with which at least one needs to be a registered nurse. The surgical count is done at a few points during the surgical procedure. The World Health Organization Guidelines for Safe Surgery 2009 discuss that before the procedure commences, a count is verbally done and documented for nursing staff to start the official instrument tracking record and to assure the surgeon that all instruments are ready for use. Intraoperatively, if any new gauze or instruments are needed in addition to the first surgical count in the instrument, then the instrument nurse must be informed to update documentation. If at any time in the procedure an incorrect count happens, the surgeon needs to be informed and the count should be done again. If a radio-opaque item is not located, then an X-ray must be performed to locate it. If the item is non-radio opaque, then a thorough visual and manual search is required to locate the item within the surgical field. A microscope should be utilised to locate small needles within the operative field to avoid needle stick injuries. The outcomes should be documented on the instrument tracking record as advised by the Royal Children's Hospital, Melbourne, Australia, 2016. And the last count should occur before the closure of the open surgical site of the patient to ensure all surgical material and equipment is accounted for and verbalised and documented before the patient surgical site is closed. Ideally, the only incidents when a surgical count should differ from the first count to the last would be the instance when the surgical device was intended to be retained in the body cavity or if there was a contaminated or dropped item. Thank you.